Welcome back to Have More Babies. As parents, we all know, well, navigating our children's health can sometimes feel like a maze, can't it?
Oh, absolutely.
You've got these medical terms, insurance questions, figuring out specialists. It can really leave you feeling a bit lost.
It certainly can. And that's precisely why we're digging into a really useful resource today. It's a guide for parents put together by pediatric physicians right here in Roswell and Marietta, Georgia.
Okay.
Think of it as maybe a shortcut to feeling more confident, more informed about your child's health.
Exactly.
Yeah.
That's our goal here, to
Yep.
pull out the essentials from this guide. We'll be talking about, how to pick the best pediatrician, making sure care is coordinated,
Right.
crucial things like preventative steps, vaccines, what to do about those common kid illnesses,
Hmm.
and even some quick reminders on car safety. Okay, so should we dive in? First things first, I guess. Having a great pediatrician, how fundamental is that?
Right. It's absolutely fundamental. A pediatrician isn't just any doctor. They have years of specialized training focused only on children's health, newborns right up through young adulthood.
That specific training must make a huge difference.
It really does. They understand how kids' bodies develop differently, how illnesses might look different than in adults. For instance, they're trained to spot those subtle developmental milestones or maybe catch potential issues really early on.
It goes beyond just like treating a fever or a scraped knee, doesn't it? Although they definitely do that.
Oh, for sure. They diagnose and treat all the usual stuff. But yeah, their role's much broader. Pediatricians are really invaluable guides for parents.
How so?
Well, they offer advice, evidence-based advice on so many child-rearing things: nutrition, sleep schedules when they're piney, understanding developmental stages, even tackling behavioral concerns as kids get older.
The ongoing support sounds amazing, especially for new parents.
It really is. And this
Yeah.
guide, it really hammers home the importance of building a solid relationship with your pediatrician, one based on trust.
Having that go-to person who knows your child's history.
Exactly, someone you can turn to consistently. And speaking of great care locally, the guide does specifically mention Omega Pediatrics as a top practice in Roswell and Marietta.
Okay, good to know. Which brings us to the next point, right? How do you actually find that great pediatrician?
Yes, and the guide has some very practical steps. First thing, check with your insurance provider. Get that list of pediatricians in your network. Always the logical place to start.
Definitely cuts down the options, yeah. And what about asking around?
Still so powerful, the guide suggests asking friends, family, coworkers, especially people who have had babies or young kids recently, their personal experiences. Really valuable insights there.
True, hearing from someone who's been there.
Mm-hmm. And then, of course, there's online research. You can look up doctors, compare their clinic hours, check out their qualifications. The guide specifically highlights looking for board certification.
Why is that so important?
Well, board certification basically means the doctor has gone through really rigorous training and testing in pediatrics. It shows a high level of competence, a real mark of expertise.
Okay, that makes sense. What else should parents look for?
The guide also mentions considering their experience, like how long they've been practicing, which hospitals they're affiliated with. That can give you extra confidence.
Right, and the practical stuff matters too, doesn't it? Like location.
Oh, hugely. Think about how easy it is to get to the clinic. Is parking a nightmare? The guide points out Omega Pediatrics has locations, 1305 Hembry Road, Suite 203 in Roswell,
Okay.
and 1841 Piedmont Road NE, Suite 100 in Marietta. And their hours are interesting too, Monday to Friday, 11 a.m. to 9 p.m.
Wow, 11 a.m. to 9 p.m. That could be a real lifesaver for working parents trying to get appointments after work.
Exactly. That later availability is a big plus for many families.
The guide also suggests scheduling a consultation, like a meet and greet.
Yes, a really smart idea. It gives you a chance to actually meet a potential doctor, ask questions, see if their sort of style clicks with your family, get a feel for the place.
And trusting your instincts.
Absolutely critical.
Yeah.
The guide emphasizes this. If you don't feel comfortable, for whatever reason, keep looking. That relationship is just too important for your child's long-term health.
Good point. And the office staff matters too, right?
Definitely. Helpful, friendly staff can make your whole experience so much better. It all adds up.
Okay, so you found your pediatrician. Fantastic. But sometimes care involves more people, doesn't it?
Yeah.
The guide talks about coordinating care. Why is that such a big deal?
It's vital because, well, Kids sometimes need specialists, right? Or maybe different kinds of therapy. Communication and teamwork between everyone, your pediatrician, specialist, therapist, it's essential.
To avoid mistakes.
Yes, and to make sure everyone's working towards the same goal, it helps get the best results for your child.
The guide mentions this idea of a medical home, usually the pediatrician, to kind of streamline things.
Exactly. Having that central point person, your pediatrician as the medical home, means they oversee the big picture of your child's health. They coordinate referrals, make sure information flows. It's about a whole person approach, not just treating sickness, but focusing on wellness too.
That makes so much sense, like having a quarterback for your child's health team.
That's a great analogy. And technology helps here too, like electronic health records. The guide touches on that.
How do those help?
Well, they let different doctors securely see and share important info, medical history, test results, allergies, medications, instantly.
Oh, wow. So they can quickly see allergies, for instance, prevent problems.
Precisely. It improves efficiency and, crucially, safety. The guide also mentions, regular updates among the team and really involving the family, the child, too, when appropriate, in decisions.
It really is a team effort.
Yeah.
Okay, let's shift gears a bit to something the guide really stresses. Preventative care and catching things early.
Yes, being proactive. This is where you can make such a difference. Preventing illness or catching issues early is just key for long-term health, avoiding bigger problems down the road.
And those regular well child checkups are central to that, aren't they?
Absolutely essential. They aren't just about weighing and measuring. They're chances for the pediatrician to screen for potential issues, developmental stuff, health concerns, and offer guidance on, nutrition, safety.
All that age-appropriate advice.
Exactly. And finding things early often means simpler, more effective treatment.
Makes sense. And besides checkups, the guide talks about healthy lifestyle. Seems obvious, but
It's foundational, isn't it? Making sure your child eats well, gets enough exercise, sleeps enough, learns to manage stress. It sounds basic, but it seriously lowers the risk of chronic illness later on. And of course, a huge part of prevention is vaccinations.
right, vaccinations. The guide spends a good amount of time on this.
And for very good reason. Vaccines are just critical for protecting kids, especially when their immune systems are still developing. They prevent the spread of serious infectious diseases. The guide mentions things like meningitis, pneumonia.
Serious stuff. Now, some parents have questions about safety. What does the guide say?
It's very clear on this. It emphasizes that, look, years and years of extensive scientific research consistently show vaccines are safe and incredibly effective.
So the benefits heavily outweigh any potential risks.
Overwhelmingly so, according to the science. And the guide makes another really important point.
Yeah.
Vaccinating isn't just about your child. It's a community responsibility.
Herd immunity.
Exactly. When enough kids are vaccinated, it protects everyone, including those who can't get vaccines, maybe because they're too young or have certain medical conditions.
So it's a public health thing.
A vital public health measure, yes, not just an individual choice.
Okay. Now, even with best prevention, kids get sick sometimes. It happens. The guide covers common issues too.
It does. Early childhood, lots of little bugs going around, respiratory stuff like the common cold. The advice is simple but effective. Tissues, lots of hand washing. Try to avoid close contact with sick people.
The basics we all know but need reminding of. What about tummy problems?
Also super common, constipation, diarrhea, stomach aches. The guide suggests focusing on a healthy diet with fiber, plenty of water, and regular exercise to help prevent and manage those.
Good tips. And I'm glad to see the guide addresses mental health too. That's so important.
Absolutely vital. It acknowledges kids can face things like anxiety and depression. It stresses seeking professional help, pediatric mental health specialists if you have concerns.
And creating a supportive home.
Yes, a supportive home environment and encouraging open communication are highlighted as really crucial.
It's a good reminder that mental health is just as key as physical health. Okay, so if we were to boil it down, what are the main ways parents can maximize their child's health based on this guide?
It really comes back to being proactive and informed. Focus on that preventative care. Regular pediatrician visits, staying on top of vaccines, building healthy habits at home.
Being an active participant, not just passive.
Exactly. Be proactive, seek medical help when you need it, understand the recommendations, follow through on treatments, and be an advocate.
What does being an advocate look like?
Discussing treatment plans, asking questions until you understand, feeling empowered to seek a second opinion if you feel you need one. It's about being a partner in your child's care.
That empowerment piece is huge for parents. Now, this guide we're talking about is from Omega Pediatrics. What does it say about their specific approach or commitment?
It highlights a few key things. First, their team experienced, board-certified pediatricians focused on care from birth through adolescence, and they really make a point of staying current with medical advances.
So you know you're getting up-to-date care.
Right. They also really stress preventative health, following CDC vaccine guidelines closely, emphasizing those regular wellness visits.
Hmm.
And then there's accessibility and convenience. They mention you can actually call and speak to a person, no navigating endless phone menus,
Oh, that's nice.
and ample free parking at both the Roswell and Marietta locations we mentioned earlier.
Those practical things really do make a difference when you're juggling everything.
They really do. And finally, the guide talks about their commitment to attentive support and clear communication, for follow-up questions or if urgent concerns pop up. It really paints a picture of them wanting to be a trusted ally for families.
It definitely sounds like they're focused on making things easier and less stressful for parents in their community. So for listeners in Roswell, Marietta, or even further afield who want to learn more about this approach,
Yeah, for more details and to see how Omega Pediatrics could partner with your family, the best place to go is their website, omegapediatrics.com.
omegapediatrics.com.
Got it.
Okay, great resource. So as we wrap up, what are the main takeaways we want people to remember?
I think, number one, the absolute importance of a dedicated pediatrician you trust, someone who specializes in kids. Number two, the power of being proactive, checkups, vaccines, healthy habits. It makes a huge difference. And number three, remember, you're an advocate. Be informed, ask questions, partner with your child's healthcare team.
Excellent summary. And it's clear Omega Pediatrics aims to be that partner for families locally. Now, here's something to think about. With so much health information out there, how can we, as busy parents, best weave these proactive strategies into our already packed lives to really help our kids thrive?
Definitely food for thought. Thank you so much for sharing all this today.
My pleasure. And again, for more information, do check out omegapediatrics.com.
Yes, please do. And if you found this conversation helpful, we'd love it if you'd like this video, subscribe to our channel for more discussions like this, and maybe share it with other parents you think might benefit. Thanks for listening, and goodbye for now.
Goodbye, everyone.